are ready to get this mental health day started. I know I'm going to need some help in that towards the end of this week anyway. So thank you everybody for tuning in to another monthly installment of the Health and Wellness Council's presentation on aspects of health. Had you come into the chamber at this point in time, you could be eating a nice yummy sandwich. We have those available, so maybe next month everybody can come down for that when we talk about food. But for today, we're here to talk about mental health. I have three experts on mental health who are going to be giving you the definitions of how you should be taking care of yourself. And without further ado, I'm going to let these fine, intelligent people get started. Thank you very much. Have a great day.
Thank you, Simon.
Thanks, Simon. Hi, everybody. My name is Dr. Lisa Harding. I am local here to Milford. I have a private practice called Depression MD. I am an expert in depression and the mood disorders. And whenever we talk about mental health awareness, I don't like the term. I think we're all aware of mental health problems, but I think one of the things that I think is important is how we speak to each other about mental health disorders, the definitions that we use. I don't think we give enough to the language that we use around mental health disorders. Like, so somebody has depression, they are not a depressed person. These are just aspects of people's lives. I decided to talk about insomnia, specifically because insomnia, regardless of the kind of disorder that you have in terms of mental health, if you don't sleep, it doesn't matter. I often tell patients that the only difference between me and a 4-year-old toddler is that I'm socialized not to throw myself in the supermarket and scream when I have not had a good night's sleep. But the things that are happening in my brain are not really dissimilar when I'm sleep deprived. It's just that I think somebody would call 911 if they saw me in the island Stop and Shop screaming on the floor. And so thinking through what insomnia is, I just wanted to give you guys a definition, and let's talk about how we can all sleep better. So insomnia occurs when you have trouble either falling asleep or staying asleep. So people refer to it in layman's terms versus medical terms. So insomnia is a standalone diagnosis by itself, and that's why that belongs to the sleep study specialists. But in psychiatry and in the field of mental health, when we talk about insomnia, we talk about it being related to either depression, bipolar, or even patients with schizophrenia and other thought disorders. And so when we talk about it either in the short term, calling it acute, or it can last for a long time. So chronic insomnia, which is a lot of adults, believe it or not, when we come to the statistics, you guys will see that a lot of adults suffer from insomnia. So what is the time frame? Acute insomnia is 1 night to a few weeks. I will tell you that I read a statistic that said that it takes 3 nights of bad sleep to undo 3 months of good sleep hygiene. Oh, wow. So that binge watching on the weekend, those kinds of things actually ruin your sleep architecture. And so when it's chronic, it can go from more than 3 nights to up to 3 months or more. And some people actually suffer from insomnia that's chronic that they actually have to take medication for. So let's look at the statistics. Lots of things have factors. We're looking at this multifactorial approach to everything in mental health. Psychiatry has moved to what we call the biopsychosocial model, where we really don't look at just one aspect of a person's health, and we really look at them as an entire individual. So you'll see later on, I'll talk about the amount of sleep per age. So your age really determines how long you should sleep. All of the factors like stress, as well as male, female, the amount of quality and time to sleep that is needed, all of those things, the environment, the type of work you do, if you work shift, if you work third shifts, if you work on call. So all of those things really tend to affect your sleep. So it's really important that we understand that there are really 5 stages of sleep. It's not important to get into the nitty-gritty of it, but what is really important to understand is that none of us should be taking longer than 30 minutes to fall asleep. We really should not. And when we go through our stages of sleep, we cycle through these stages of sleep various times during the night. And each stage of sleep has with it the things that are key. So if a person is woken up in one of the deeper stages of sleep, they wake up confused, and it's because their brain is basically offline. I don't know, I'm sure all of us in this room have had people that we've heard of, they're sleepwalking, talking in their sleep, not respond. All of those brain functions occur at one of those different cycles in this sleep cycle. And so it's really important to understand that you must get a full night's sleep. And for most people, the average is anywhere from your age between 6 and 10 hours for like what humans need to for sleep. So these are the stages, like I said. You really, in the first stage, it takes about 1 to 5 minutes. In the second stage, it goes up to about 20 to 30 minutes. The deepest stage of sleep, I like to say that people, you must be getting that rest in that stage 3 sleep. You know, we're moving away from the culture where too much work, and people that work too much are not really, it's not a bragging honor anymore. So, you know, I can function in 2 hours of sleep. It should not be a bragging right, because what it's telling you is that you're really not letting your brain cycle through these stages of sleep. And so how much sleep do you need? I want you guys to either take a screenshot of this or look at this, but because we live in a world where I think multitasking and not slowing down is kind of one of the things we're all subjected to, I wanted to, at this point, ask us all to close our eyes and uncross your legs if you have them crossed, and plant your feet on the ground, and really square yourself in your chair. And if closing your eyes is uncomfortable, you can have a soft gaze just in front of you on the floor, and just listen to the sound of my voice. You have taken time out of your busy schedule today to learn how to relax and to understand where sleep is important and how to optimize it. You can place your hands on the handles of the chair or on your lap and gently begin to bring your awareness to your breath, not changing how you're breathing, just making yourself aware that you are breathing. Paying attention to the air going into your nostrils, down the back of your windpipe, into the lungs, and filling up the recesses of your lungs. If you've done this before, you may be able to even realize the change in temperature of the breath as you exhale it. And if you're wearing a mask, you're probably aware of the heat of the breath as you exhale it. Be aware that your feet are planted, your sits bones are even in the chair. Maybe you begin to realize the rise and fall of your chest. And so we're going to take 5 breaths. We're going to inhale for a count of 4 and exhale for a count of 4. Inhale and exhale. Inhale, 2, 3, 4. Exhale, 2, 3. Inhale, 2. Exhale. And last breath, inhale and exhale. Gently begin to open your eyes. This exercise is really to show you that things that you can do for your body physically really can affect your mind. This is actually a breathing technique that I have a lot of our patients in the office do. You guys, if you ever come to our office, you guys know Jisa. She is the head of our mindfulness. And we teach all of our patients breathing techniques. She doesn't like when I use the term breathing retraining, because she says you can't train somebody how to breathe. But I think breathing techniques really tell us that we can control the physiology of our body. And if you do relaxation or breathing techniques before sleep, it is one way to de-stress. And I think that that's the really important part of the insomnia, right? Like, we can define it, we know what it is, we know how much you should sleep, but what are we really doing to optimize us getting to sleep? So we're gonna go to that now. So this is actually on our website. It should be available for download, but it really talks through all of the techniques that we should be going through for sleep. So I'm just gonna briefly touch on these techniques. So one of the things I think, so we have about 9 or 10 up there. I'm going to just put 3 or 4 of them. And this is available for you guys if you want to download it. The bedroom is really only for intimacy and sleep. We have really moved our workspace, and the pandemic was super horrible for this. I as well am guilty of it. Working in the bed, eating in the bed. Some of us, we had multiple people working from home. The bedroom became some people's makeshift offices. Now that things are opening up again, I really encourage you to think about the sanctity of the bedroom, the lighting in the bedroom. A lot of people you really should not have a television in our bedroom. Still guilty here, but we really shouldn't. But I also don't complain about sleep. And so you really need to recognize the purpose of the bedroom. The blue light filter. If you are watching this on your phone, when this call is over, please go onto your telephones and turn on the blue light filter. The centers of your brain are actually activated by blue light. And so one of the things the cell phone companies were mandated to do is that they actually have to have a blue light filter on there. So even when you wake up at night and you're scrolling, that blue light filter is actually on there. And you guys will probably be attuned to this. A lot of people wear blue light blocking glasses when they're working on the computer a lot. So not only does it affect the sleep rhythm, but apart from the fatigue, it affects that as well. The other thing is caffeine intake. And you will realize my theme is highlighting all of my own bad habits and telling you guys not to do it. So caffeine intake. When I was at Yale, my husband will tell you guys there's one point where I used to drink about 6 shots of espresso a day. Yes, so that was like a power hit. So one of the recommendations is no more than 2 cups of coffee, and 2 cups of espresso coffee has about between 80 and 200 milligrams of caffeine. So it's equivalent to like a caffeine pill. And you really should take the last caffeine drink before 2 p.m. in the day, or else it starts to affect the nighttime. I know, I see you guys looking around with judging eyes. And so that's one of the things. Another really, really big one, and of course, again, I'm also culpable of this, is exercise. Exercise should really be done between 4 to 6 hours of sleeping, because it then activates you, unless it is like a restorative yoga class or something that's really not activating your body and or your muscles, because it takes a while to unwind in the evening. And so you guys will see the other tips on there. And so what is treatment? I think this is the most important thing. Like, people think, I think we move to an age in medicine where sometimes people think that there's a pill for everything. And if I had a pill to de-stress your life, that would be my first treatment for insomnia. So the actual first line treatment for insomnia is actually cognitive behavioral therapies. I'm going to skip the other parts because Phyliss is going to give you some good tips on which essential oils can really help that. But really, cognitive behavioral therapy, before you think about getting to a medication, first look at all those sleep hygiene tips. And if you're not doing those things, then you really should not be moving on to another stage. You really have to be optimizing the things that you can optimize before you move on to a sort of like a pharmacological intervention for it. And those pharmacological treatments are fast, and so also we'll get into those. Go for it. Yeah, and this is another summary slide of it. So I'll let Phyliss take over now.
Thank you. It was very good, and I did get rid of the TV in my
You
bedroom
did!
a long time ago. So
Very nice.
we don't have it there anymore. Hi, I'm Phyliss Mullins with A Healthier Life with Phyliss, and today I'm going to explain what essential oils are and some of the helpful ways that they can help support emotional healing and help you feel better. So we'll start out with what are essential oils. Essential oils are safe when they're used appropriately, and they are basically compounds that are extracted from plants using steam distillation or cold pressing, depending upon the particular plant. And studies have shown that there are little to no side effects or addictions using these extracts, which can have amazing health benefits. One of the biggest things is safety comes first. You have to look for oils that are pure. Purity equals potency. So you want to get something that's pure, or it may not do what you think it's going to do. And the majority of oils that are out there are synthetic, meaning that they have other products like petroleum or harmful contaminants in them. A lot of times it's how they're extracted from the plant. So the purity and chemical makeup of the plant is imperative when you are looking at essential oils. And there was a study done on 33 different essential oils. It was a blind analysis that were selected at random from 11 different companies. And only 3 companies were found to have oils that tested pure from any adulteration. And doTERRA was one of them. If you want to know what the other ones are, let me know. So when I refer to essential oils today, I'll be talking about doTERRA oils, and they are effective. Their chemistry consists of blocks of hydrogen, carbon, and oxygen molecules, and because most of the body is made up of oxygen, carbon, and hydrogen atoms, essential oils can permeate the cell membranes and work with the body to address issues and root causes on a cellular level, which makes them highly capable of helping the body chemistry that contributes to your cognition, mood, and emotions. And they're also more affordable than traditional medical care, all cost only pennies per dose. And there's obviously places for both medical care and, essential oils or other holistic things. So it's not one versus the other. You have to use them in tandem. And there are 3 different ways to use essential oils. The first way is aromatically, and you do that through diffusion. In most cases, people have diffusers that diffuse it into the air, and you can combine all sorts of things and put into it whatever you need at the particular time, or just make your house smell nice. The other way, you can smell it directly from the bottle, or you can put a couple drops in the palms of your hand and put it over your mouth and nose and just smell it that way. And when inhaled, essential oils aromas are 100 to 10,000 times more potent than from the plant itself. So that enters the olfactory system, affecting the emotional parts of your brain. And it can also cleanse the air and support your respiratory system. Then there's topically. When you put oils on topically, you can put it directly to whatever part of your body is bothering you. If you have an elbow that's in pain or whatever, you can put it directly on the elbow. So you're putting it where you specifically need it. It is best to use a carrier oil with it, however, when you're doing it topically for 2 reasons. It helps to make it so it's not sensitive, and you don't have a reaction to it. Your skin could be sensitive to it. But also it helps the oil not dissipate. It helps it get deeper into the area that you're trying to put it into. And oils are easily absorbed through the skin, into the bloodstream, and the capillaries. And then the third way is internally, and you can put it into a drink like water or your juice or whatever you're drinking. You can put it into a capsule and swallow it. And in some cases you can put it under your tongue, but you gotta be a little careful with that because some are hot oils and you don't want to do that. But that internally gives you an effective method of delivery of all the medicinal compounds and via the gut-brain axis, so for your stomach to your brain. And in this case, I'm mainly going to be talking about aromatically when we're talking about mental health. The hypothalamus is a tiny control center in your brain that orders the brain to send out stress hormones when it's stressed. And while it's designed to protect you, back in the days of fight or flight, prolonged stress can have devastating effects on physical and mental well-being. Symptoms include your irritability, anxiety, depression, headaches, insomnia, poor immune function, and increased blood pressure. And on this, if you can see the screen, I've shown a few of the oils that can help with some of these, such as our citrus oils, frankincense, lavender, peppermint, as well as a few others. Studies are done on several essential oils as related to post-traumatic stress syndrome, or PTSD. And, you know, we all acquaint that with people coming back from war. But it's more than that. PTSD is a development of a cluster of symptoms following exposure to some sort of a traumatic event. Police and firefighters are prone to it. Your doctors and nurses, especially through the pandemic, would be as well. But trauma can be caused at a young age or from any kind of traumatic experience. So children all the way up to, you know, however old you are, can have some sort of a traumatic event happen to them, and it can produce the PTSD type symptoms. Now, in the brain, you have your prefrontal cortex, which handles your impulse control, focus, concentration, and PTSD impairs fear and stress responses, which can produce emotional numbing. And several oils on the other side of the brain here, or the screen, that can help are cardamom, turmeric, and cinnamon. Now, in the hippocampus, which controls the inability to deactivate the stress response, fear, memory dysregulation, and impairs extinction of the fear conditioning. This is as it relates to PTSD. Helpful oils with that are cardamom, turmeric, cinnamon, basil, and clove. And some oils have the ability to surpass the blood-brain barrier, where they can directly affect the amygdala, which plays a role in storing and releasing your emotional trauma and controls hypervigilance. It's also closely related to the limbic system of the brain, which is responsible for long-term memory and impacts mood and emotional response and the management of the stress responses. And oils can be beneficial in reprogramming an individual's response to past experiences. And some of those helpful oils are turmeric and lavender. Now, there's a whole lot, but you know, those are a few. When you're using lavender aromatically, several studies have confirmed that it has sedative effects on the central nervous system. So lavender is a good thing to diffuse when you want to go to sleep too. It also helps with the nervous system in reducing the fear response, agitated behavior, anxiety, and it calms the nervous system by decreasing the heart rate and your blood pressure. Cardamom is, a study was done on that, and it found that it resulted in lower anxiety-like behaviors, inhibited nerve cell damage, reduced oxidative stress, and inhibited inflammation in the brain, resulting in improved cognitive function, protection against stress, and anxiety-like behaviors and memory function. And turmeric, after 14 days of daily administration of turmeric, it aided in the reduction of the fear response, helped regulate inflammation of the nervous tissues, and also may aid in reversing memory deficits and increase blood flow to areas of the brain that are affected by PTSD. Basil helps support those who are feeling overwhelmed or fatigued, gain a sense of renewal and peace, both physically, mentally, spiritually, and emotionally, so that they can better cope with those situations. Bergamot, and I found this one really interesting, so I'm pulling mine out tonight. This is an uplifting citrus oil, and it instills a sense of reassurance and confidence regarding oneself, and helps the individual recognize their worth and value and accept their imperfections. And studies reported that its ability to reduce stress, anxiety, blood pressure, and heart rate. And in participants with PTSD who participated in a study for 2 weeks, found that having a bottle of bergamot available to them during the day and where they can sniff it right out of the bottle, and diffusing it each night actually helped with many of their symptoms, including better uninterrupted sleep, the ability to remain calm in stressful situations, and reduced anxiety and lessened panic attacks. Cedarwood is good for supporting those who may feel alone, abandoned, or disconnected from their relationships. And it also helps one to feel more secure, wanted, and supported. While symptom relief can happen immediately, every person is different, but the trend has been seen in the research that when you use an oil consistently, more benefits are enjoyed, and they recommend that a minimum of 2 weeks of consistent use daily is recommended in order to have longer term lasting effects, and that's what the participants using the bergamot did find in the study. So stress and emotions can harm the body in ways you probably didn't think about. So in this case, anger weakens your liver, grief weakens your lungs, worry weakens your stomach, stress weakens your heart and brain, fear weakens your kidneys. Love, on the other hand, helps lower your blood pressure as well as your cholesterol. And laughter is helpful in reducing stress and makes your blood flow more freely. So we need more of those. And we also have a line of oils that are pre-mixed with fractionated coconut oil and easily roll-on bottles that can help with a lot of those different symptoms. We also have a group of oils that were specially formulated for children. And as I said, children are not immune to any kind of traumatic injury or mental health issues. And especially having gone through the pandemic and having to go home and can't see their friends and everything else, now they're thrown back into school, and now they're worried about getting back together with their friends. They're worried about schoolwork. Did they get behind? So we have a whole set of oils that were formulated just for them. They're color coded with instructions so the kids can actually use them for themselves. So it can help with their confidence. It can help with on the stresses that they have being in school or with their homework, help them relax, all those different things. So this just shows a few of our different oils that I didn't necessarily mention, and how they affect you. The one thing that I like the best is our adaptive collection. It's fairly new within the last couple of years, and I myself have found that this is really an awesome collection. Having gone through the pandemic, having gone through elections, and we got war going on, and all the news stations just bombard you with everything negative in this world. I got to the point where my husband was worried about me. He's like, "What's the matter with you?" I just couldn't calm myself down. And our active collection actually helped me with that. So that's one I would absolutely recommend. And it was formulated specifically for that to help calm you down and everything. So basically, in summary, essential oils are generally regarded as safe by the FDA. They're low in risks of terms of unwanted side effects. And it's recommended to use them in moderation, but make sure that they are pure. Don't go to Walmart and pick up a bottle of lavender that probably has absolutely no lavender in it at all and more things in it that can harm you. So you want to make sure that you're going with a very reputable company. And doTERRA has over 100 oils and blends. So what doesn't work for one person may work for another, same as medicines do. And so you've got to work with it. And, I would work with you to see what your needs are. And I'd love to get in touch with anybody if you want any more information. My information up here is on the screen.
Thank you.
You're welcome.
Before I go into my part of the presentation, I want to first introduce who we are as a group. So this is brought to you by the Milford Regional Chamber of Commerce, and in particular, the Health and Wellness Committee. We are a group of health and wellness businesses that are the chamber members, and we do these things that are free resources for the public. So we do these Wellness Wednesday presentations that are free and open to the public to join in. You can come in person and get a free lunch on the house provided by the chamber, or join us on Zoom or Facebook Live. I will not have a presentation for you, so this is all going to be on camera for me. I'm Shirley Chock. I own Aiping Tai Chi. We are in Milford. I am a Tai Chi instructor. I've been training in it and teaching it for a long time. I've been training in it for over 20 years. And I have a different perspective on stress management, because I come in from that physical side. Dr. Lisa mentioned how much you can do to help your mindset and your mental well-being through the physical side. And she took you through a guided meditation to focus on breathing. So I do that to kind of an extreme level where we're really focusing on tuning in to the tensions in our body, because Tai Chi in its authentic form is an internal martial art. So, and this is a martial art that only works if you learn how to identify where the tensions are in your body, because the tension is what's used to control you. So if you think about the physical act of pushing something, what are you pushing? You're finding something to push against. So you can push this table because there's solid mass that you can control and push. But what if you have something like water, where you can't actually find that center of that mass to push? So this is true for our physical bodies as well. If you're tense, you've basically turned yourself into something like this table that a person can find that center and control you and push. If you learn how to loosen that tension and relax that tension and redirect force, then you don't let that tension in your body be used as a weapon against you. So this was why Tai Chi was developed originally. What people found after practicing this martial art was that they also became so much more less stressed through this practice, healthier in body and in mind. So these practices are now really effective in stress management, because when you're able to tune in to the tensions in your body, then you can start relaxing the tensions in your body physically, which then has that corresponding effect of relaxing the tensions mentally. So we did a little bit with Dr. Lisa on that. So I'm going to take that a little bit further and talk a little bit more about stress. The word stress is used a lot, but what is stress? Like, what is it? It's not all the things that you need to do. Those are just things that you need to do. It's not stress until it has some sort of physical manifestation in yourself that turns into some sort of tension in your mind, in your body, and they're correlated. So when you're stressed out, that being stressed out can be the one thing that stresses you out. It could be the 10 things that you need to do that stress you out. Whatever it is that stresses you out, it has the same physical effect. When you feel that anxiety, that tension in your mind, you'll also notice you'll hold a lot of tension in your jaw. You might clench your teeth. So we can focus there. Once it's formed in your mind, it's kind of like the runaway freight train that's had the brakes cut, that you can't stop. You try to pull the emergency brake and you can't, because it's this runaway freight train. It is out of control. So what we can do is come through it physically as a system override to get it to pause, so that we can find our center, get back to balance. And one simple thing, if you only have 1 minute and you're feeling stressed out, just wherever you are, you can notice the tension in your jaw So I'm going to give you a technique that we use when we practice Tai Chi. We have a very particular tongue position. I bet you never notice how much tension you actually hold in your tongue. The tongue holds tension as well. So take your tongue and gently let it rest on your upper palate, right behind where the upper teeth are, and let that tongue just spread. So just feel the entire width of the tongue gently rest up on the upper palate. And then let your lips gently close. And notice if you let your tongue form in that shape and let your lips gently close, your teeth are separated. Your lips form a little Buddha smile. It's just a little bit of a gentle upward smile. And if you're stressed all the time, this will feel very strange to get your face to actually relax and get your jaw to relax. So just stay with it for a little bit. Just to get your tongue and your lips to get used to this position, to relax the tension around your mouth and relax the tension in your jaw, relax the tension in your tongue. In Chinese traditional medicine and our Tai Chi and our Qigong practices, we have a saying, when your tongue is relaxed, your whole face is relaxed. So you can kind of get a little glimpse into that when you can relax your mouth and your jaw. Notice how the muscles around your eyes also relax. These are connected. The muscles around your jaw, the muscles around your eyes. If you can relax the tension around your eyes, then you'll notice that that connects with the tension in your mind. These are connected. So if you can relax your tongue, relax your jaw, you can relax the tension around your face, relax your mind. Only takes 1 minute to do that. Now, if you have another minute, just one more minute, we are going to notice our posture. Your posture affects your mental well-being and your mindset. If you're not feeling well, you're slumped. Your spirit is low. So one other thing you can do is notice your posture. So when Dr. Lisa was giving us that little meditation, she talked about evening ourselves out in our chair. So there's a particular body position that we're in order to do our practice properly. There is a particular position that we try to be in, and it's this feeling of being suspended from the ceiling at the top of our head. And you just imagine, let's say there is a knot, a string knotted right at the top of your head, and you're just hanging. When you hang, you don't lift. So think of the act of hanging from something. The weight is actually down. You let yourself relax down and let your chin tuck. So you let that neck relax, let that chin tuck, let just the top of your head lift up. And you'll notice that your core should just very, very lightly engage. It's almost like there's a net that envelops you, holding you up as you relax down and you hang from the top of your head. When this point on the top of your head lifts up, it lifts up your spirit. When you slump down, your spirit's low. When you're upright, your spirit lifts up. When you're in this position, then the third minute, if you have one more minute, just 3 minutes now, you'll notice that being in this particular position, letting that face relax, being in this upright posture, but relaxed and hanging down, your breath can lengthen. When you're slumped in this bad posture, it affects your breathing. Dr. Lisa talked about the importance of breathing. When you're slumped like this, you can't take a long breath. What we want is a naturally long, slow, deep breath that's not forced, natural. So one way that we can do that is by getting ourselves into a better posture so that we can let that breath go down longer, right? So now, 4 minutes, just one more minute. Notice as you breathe the tension in your chest. So when we practice our breathing exercises in Tai Chi and Qigong, we talk about breathing down into the abdomen. Now, of course, we can't physically breathe down into our abdomen, but visually we can imagine this, right? And Dr. Lisa said about following your breath. That's something that we can do as well. Follow your breath. Just let your mind imagine. You can actually visualize and see where that breath ends and feel where does it end. And you'll probably notice that your breath will end here in your chest. And I want you to visualize if your breath were a stone that's just sinking down. It probably gets trapped here in like a ball of tension right in your chest here. So if you visualize the tension is like a big knot, what I want you to do is just every exhale, and you don't have to force a breath, just natural, but every exhale, it's like that big knotted ball of stress, the ends loosen up a little bit. Just loosen up a little bit until that tension in your chest kind of dissipates and it just dissolves and dissipates until everything here becomes soft. And if your breath is a stone, it can just sink down lower. And just follow that practice down in your abdomen as well. Your abdomen holds so much tension. You probably don't even realize how much tension your abdomen holds when you're stressed. So unknot that. Just let that tension loosen up. And imagine like your whole torso is this soft, empty cavity that the breath could just sink down. When you allow that to happen, your breath will just naturally become longer, thinner, slower. And then keep that tension free as you breathe up. And when you're able to do all these three things together, which just takes a few minutes, letting that tension in your face relax by letting the tongue just spread around your mouth, loosening up that tension in your jaw, letting yourself have better posture to facilitate better breathing so that your spirit can lift, then that will allow your mind to be able to relax. And it is this compounding effect. It's a compounding effect of negative feeling, and it's a compounding effect of a positive feeling. So if we can let all of these things work together, then we have done two things. One is we physically relax the tension in our body, which lets our minds relax. And the other thing is we've stopped that freight train that's run out of control. And that's really important to just reset, because those thoughts are not going to help you. So getting caught up in those thoughts are not going to help you. So if we can just stop that freight train from running out of control, get us back to center, then you can become more balanced and we can begin again. It's like that reboot. If your computer's crashed and you need to reboot, there's a reboot for our body as well. So that's what I have to offer for this presentation. And if you want to find me, I have a YouTube channel where I teach Tai Chi, Qigong, meditation. I have classes that I teach in person, and they are also Zoomed in our school in Milford. We've got over 5,000 square feet of training space that we just moved into Milford. And I also have an online instructional library of videos through our Patreon. So you can find me online. Oh, and I should mention that my Twitter handle is The Stress Bender. So that's what I am known
The
as.
stress what?
The stress bender.
Vendor.
Like
Yes,
Avatar. the
Like
last
Avatar,
airbender.
like Avatar, the last airbender. Right, I'm the first stress
We all know
bender.
who has children under 20.
Yeah.
I want to say thank you for everybody coming. If you do have any questions, feel free to post them on the Facebook. This will stay up there for a while. We're going to put it up on YouTube. You can always put your comments on YouTube as well, and I will make sure that everything gets a reply. So from the Milford Regional Chamber of Commerce and our Health and Wellness Committee, thanks for coming to another Wellness Wednesday. I appreciate everybody being here, and have a wonderful day. Stay healthy and stay calm. All right. Bye-bye now.
Wow.
Yeah.
Bye.